Hmm. So today I am going to start the practical session of the palpation of shoulder girdle. So in theory lecture we have already covered the how to palpate the posterior aspect of shoulder girdle. So here this is the practical session. So I am going to discuss all the landmarks which are we have discussed in theory. So as you all know that all the landmark related to the scapula is basically the example of bony edges or border. So this is the orientation of scapula. Here the medial border is found. Here inferior angle, here superior angle, here spine of scapula, and this side is lateral bone. So let's start with the first with the palpation of medial border. So for palpating the medial border, this contour we can observe. It is we can uh, get an idea about the location of the scapula. So this is the presumed anatomical location of scapula. First of all, you have to place your finger pad somewhere between the mid thoracic region. So I just going to start it from here. Slide it in the lateral direction, sliding it, and ultimately it encountered with a bony consistency. I can feel the edge of the medial border over here and confirm it. We can follow it in inferior direction and in superior direction also. It is easy to identify the lower portion of the medial border very easily because there is less muscle attachment or it is free of the means as compared to the upper region, it is little bit less attachment are found here. So by following this, we can reach the when we are following in inferior direction, ultimately we will reach over the angle of inferior angle of scapula. This is one approach where you identify the medial border and slide in inferior direction or superior direction. By sliding your thumb pad or finger pad in inferior direction, you will identify the inferior angle, and by sliding in upward direction, you will find the superior angle. Another approach, like directly identify the inferior angle. Just place your finger pad somewhere little bit more inferior to the scapular location and slide it obliquely towards the shoulder joint like this. See, again it is striking for the bony landmark. For confirmation, either you have to make this grip that should be perpendicular the presumed location of the scapula, or it should be perpendicular to the inferior angle of the scapula. Another grip, we can make it like this, slide it in upward direction, and ultimately you will grip the complete scapula. If suppose the subject is bulky or have more muscles and you are not able to identify it, so there is a trick. Just ask the patient to place his dorsum of the hand over the lower back region. Now you can see it is getting out. It is bulging out. This is medial border. Relax. This is medial border and this is inferior end. So just place your finger pad. Again, patient will. Okay. So just mark it. This is the location of inferior angle of the scapula. Just palpate and follow the palpating finger. Confirm it by palpation and just follow. And ultimately you will reach over the more superior part of the scapula. Okay. But this area is thicker because it provides the attachment of several muscles, especially your upper fiber of trapezius. So it is little bit thick and It is dense soft tissue are found over here. So we can use another technique. Just place your finger pad somewhere over the base of the neck. Slide it in oblique manner as the presumed location of anatomical location of the scapula. Apply little bit more pressure, slide it down, and ultimately you can see it is, you can just observe the movement of my thumb pad. It is going in because this is soft tissue area, but because of the bony consistency, it is coming out. See, okay. So this is the location of superior angle of scapula. So here I have already marked this inferior, medial border, and superior angle of scapula. Another method for identification of superior angle of scapula is just place your finger pad like this and passively lift it up and down, and just when you apply this passive pressure, the superior angle of scapula will strike on the thumb pad. So three landmark is already marked. Next is identification of another landmark, that is spine of the scapula. So again we have two methods. First method, either we can identify the subcutaneous bony structure over the posterolateral aspect of the shoulder region. We can palpate a rounded area or bony elevation over here. Basically this is angle of acromion. Okay, and then slide your finger pad over this. You can follow the lower lip of spine of scapula. Just slide it down. See, it is hard bony structure. My finger is just below the spine of scapula. So this is the location of spine of scapula. This whole spine. Okay. And this is the base. This is one approach. You directly identify the spine of the scapula. Another approach, if you want to identify the upper lip, then you have to go from the upward direction. If you want to identify the upper lip of the spine of scapula, then place your hand somewhere over the descending fiber of trapezius. Apply little bit pressure, slide it down and see. Again, you can observe the movement of my finger. It is coming out. It is going in, coming out. So this is the location of spine of scapula, and basically I am just identifying the upper lip. Same way, if you want to identify the lower lip of the scapula, so again you place your hand somewhere over the body, apply little bit pressure, slide it in upward direction, and ultimately you will find the location of lower lip of the spine of scapula. Again, you can observe the movement of my finger. It is in depression and it is coming out. See. So this is the location of the lower lip of spine of scapula. So I think all the bony landmark, if you want to identify the lateral border of scapula, simply you have to ask the patient or subject to abduct the arm. It is bulging out laterally. See, it is hard bony consistency is found over there. So this is the lateral border of scapula. So I think all the bony landmark I have discussed. Now the next is two very important soft tissue landmark. which is related to the posterior surface of the scapula is one is infraspinatus, another is supraspinatus. So this is the supraspinous fossa, and you can palpate the belly of supraspinatus muscle. We can only palpate the belly of supraspinatus. We cannot identify the tendon. In most of the rotator cuff injury, basically the tendon of supraspinatus involved. But rest of the other muscle is also found. Another muscle of the rotator cuff is your infraspinatus, which is found just below the spine of the scapula. This is the location from where the infraspinatus originate, and it insert to a hair. So for the we can identify the tendon of infraspinatus. But for identification of infraspinatus, first of all, we have to ask the patient to assume another position because this is the tendon which is found underneath the muscle belly of your deltoid, posterior deltoid. So, for that purpose, we have to position the patient another position. In this position, we cannot identify. So, for that purpose, so basically for identification of the tendon of infraspinatus, this should be the position. Means patient should be in prone line and the body weight supported over the elbow, and elbow should be remain in about 70 to 80 degree of flexion. In this position, this tendon is getting out, or it is remain in contracted state. There will be more tension. We have already identified the angle of acromion. So this angle of acromion could be used for as for the localization. Means our palpation start from this location. So place your thumb pad first for this angle of acromion and slide it or just follow the joint line of the shoulder. Means apply little pressure and I can feel the tendon of infraspinatus underneath of my finger pad. So this is the location, and in case of rotator cuff tear or any other injury related to the shoulder joint, if your infraspinatus is involved, then tendonness will be found over there. That's all.